I depend on HIRTA. It's very important. Dialysis is a live or die situation. I need to have my dialysis 3 times a week. I really shouldn't miss an appointment because if I do, sometimes I end up in the hospital. That's why it's very important for us to have HIRTA.
We were inspired to create Health Connector by the need to close a critical gap in access to healthcare for people across our region. 39% of people reported having missed a healthcare appointment due to lack of transportation. Through listening sessions and community surveys, we heard directly from riders and healthcare providers that a dependable, dedicated service for healthcare trips could make a real difference.
I retired and I became disabled, and I needed to go to and from my appointments. At our dialysis center here in Perry was closing. At one point, we didn't have HIRTA to take us. We were paying $150 round trip to get from Perry to West Des Moines to our dialysis 3 times a week. And we paid that for about 3 months. Being on Social Security, it's really difficult to pay that amount of money. I started to send letters and show them that we had no way to get there. It was like a life or death situation and that I had to have service. I've been using HIRTA for approximately 3 years now. When the driver picks me up, some days I feel good. I could just walk to my bus by myself and get on. But I always know that I have the driver there to help me. There's been times when I've had to be put on a wheelchair and lifted on the lift. But my drivers are just the best.
So we know that there's folks in our community that if they were not able to take the bus, they wouldn't have a way to get to their doctor's appointments. And that's really important, especially for public health and for health in general, because we know that when people have access to care, when they're able to go to those doctor's appointments, we're able to mitigate worsening of healthcare issues. We're able to get people treatment before it becomes a crisis, that they're gonna need ambulance care.
HIRTA is very important. I feel that many of us can use it. We don't count on taxis or too many Ubers or Lyfts around here. So when you do need a ride, it's HIRTA or no one. I'm so satisfied with HIRTA. I don't know what I'd do without them.
The Health Connector makes it easier for people to stay connected to their healthcare providers and attend appointments they might otherwise miss. Consistent access to care can lead to better health outcomes, earlier detection of problems, and better management of chronic conditions. Beyond the medical benefits, it also reduces stress and uncertainty for riders who used to worry about how they would get to appointments. When people know they have reliable transportation, they feel more independent and in control of their health, which improves their overall quality of life.